Hello and welcome to the Passion Driven Pioneers interview series. I'm your host, John Channon, and today I'm joined by Tom Spencer, who is the co-founder and chief strategy officer of HealtheMed Incorporated. Tom, thank you so much for joining us today.
Well, thanks, John, for having me.
Yeah, would you like to just kick us off with a brief background as to who you are, what you do, and then the business that you're in?
Yes. The brief background is that I thought I was retired before I took this job. My last career move was to join a consulting group in healthcare, and we responded a couple of years before COVID to a request for a proposal from the state of Minnesota. And, you have to be careful of what you wish for. We responded and we were awarded the RFP. And then we had to decide what we were going to do with that award. And that kind of began the next chapter of my life. I was ready to step down and retire and enjoy my grandkids. And my compatriots said, "You can't leave us now. And so you need to stick with us through this project and getting it started." And that's what I did. Before that, I've been on what I call the three corners of healthcare. I'd been in the healthcare insurance business with group health insurance. I had managed physicians for a living. Everything from allergy to orthopedic surgery. And I had been in medical technology really beginning in the mid to early 2000s. About 2004, I and a group of others founded a wound care company, which we sold to a private investor in 2010. So that's been my career. And it was a career that was not started in healthcare from the beginning, that's for sure. I'm surrounded by medical people in my family, three doctors, including a father now deceased, and a brother-in-law, and others, all in the medical profession as physicians. And it's not something that I ever wanted to be involved in as I got started, but life has a funny way, doesn't it?
It sure does.
So that's really that's the brief summary.
So you responded to an RFP for the state of Minnesota. Talk to us a little bit about HealtheMed and kind of what they do, right? And what type of business that is.
Well, it's very simply put, a software as a service platform with a service wraparound. So in other words, it isn't quite software like Great Plains software would be in the accounting business. It's software with doctors and nurse practitioners and others who are enabled or facilitated through the use of that software in a very focused way. And the easy understanding of HealtheMed and its origins was we were asked by the state of Minnesota to come up with a novel way of improving medication adherence in populations served by the state, mostly Medicaid. And the state shared with us in kind of the workup to this proposal that their expectation was that probably 65 to 70% of Minnesotans receiving Medicaid were not actually taking the meds as prescribed.
Wow.
And so the request was really, can you come up with a way to get people interested and to actually provide some data in a feedback loop that shows that they're taking their meds as prescribed by their physicians and nurse practitioners? And so we said, sure, we'll take a shot at your request. And what really came out of that process was HealtheMed.
So you're getting ready to retire,
Yes.
and now all of a sudden you find yourself now as part of a business startup. What Tell us what the first few months, year was like in your startup.
Well, the first 4 months were very, very scripted. And let me be very clear. In 2019, we were not sure that we were awarded the RFP in 2018. And in 2019, we were not at all sure that we would begin this project. And so the first thing that we did was we did what most medical startups almost never do. And that is we acquired a payment source. So in other words, there are billions, hundreds of billions of dollars over the last 25 years that have been spent by medical companies in startup mode with other people's money that don't or have not secured a payment source. And of course, the stakes are high. Obviously, if you win, you're going to score big. But there's a boneyard out there of startups that have had great ideas, but they were solving a problem that there wasn't yet an established market for in healthcare. And so what we did is we went to the state of Minnesota and said, look, we know by virtue of our expertise and people much smarter than I, certainly in this group, we're leading the charge. And we said, we already know that this is going to be tremendously valuable to you. In fact, it may be transformational, but because we know that, we're not going to start doing business on a hope that we're going to get paid. And so we said, here are some codes that are used in the medical coding system, which is well known and well used since the mid-1980s in healthcare. And we're going to bill these charges to you, the state of Minnesota, because what we're doing is essentially valuable. And they said, well, if we don't agree, what are you going to do? We said, we're not going to continue with the project. We'll fund the demonstration phase with our own money, but then you have to follow on with acknowledgement that, in fact, this has tremendous opportunity to change healthcare for Medicaid recipients in Minnesota to begin with. And they agreed. So when we went to the market for investors, we had a contract with the state of Minnesota as a home and community-based provider, which we knew how to do. And that contract allowed us to get paid from day one with our first enrollee. And that contract was very valuable. There are mostly mom and pop home and community-based providers in the state of Minnesota, but there are several that are generating 300, 400 million in annual revenue serving the state. And we, from the very beginning, knew that we had the potential to be one of those mega producers. So we started. We went out and got investors, and we had them all lined up by February of 2020. And that, of course, is when COVID hit. So the investors ran for the hills, and we thought our value proposition was strong enough, so we stuck with them. And by August of 2020, we had them reassembled, and we had our first seed capital into the company. So in the first 120 days of operation, we began operating in September of 2020. We had a very scripted 90-day extending to a 120-day plan where we knew everything from at least what we thought we knew, We've learned a lot that we didn't know. Everything scripted, and every job that would be done by the founders, well planned and articulated, right down to who's going to be accountable to getting these things done and what's the date by which they will be done. So I call it the 120-day plan. And we were just very, very heads down to make sure that we checked every one of the boxes, everything from accounting to operations to marketing. I think we had it well planned, and we learned a tremendous amount in doing it. So that's how we got started.
That's great. So having a good solid plan, startup phase, it enabled you to even weather something like COVID.
Yeah, well, it's interesting because we're still the only company at HealtheMed that now facilitates the physician nurse practitioner house call on a consumer television. So if you have telemedicine services delivered to you in the home, typically, and I don't know about you, John, but I'm sure you know people, if you haven't had a telemedicine visit during the COVID time period, that were able to visit with their doctor on their smartphone or their tablet. So what we determined very early on was that smartphones and tablets were okay, but tablets had a way of disappearing, and there was a multi-million-dollar experiment with the US VA that proved that tablets weren't the answer. And people that used smartphones for regular telemedicine visits had to always remember their login and password, right? And so getting that done effectively for a medical visit proved to be very elusive. And what we also knew was that after COVID was over, the hospital systems and the health systems that owned clinics and hospitals and outpatient centers were going to go back to business as usual, because their business is getting people into their centers so the centers can bill for those visits. Their business was not making house calls. So we just felt from the very beginning that one of the differentiators for our platform, which has many wonderful aspects to it, was that we were going to have a permanence in the home. And today, if you're a HealtheMed user in Minnesota, you meet with your doctor on your timing in your own home on a television, where HealtheMed literally is, as old timers would say, a channel, right? Like you used to turn the channel to ABC or CBS or that sort of thing. And even though we're an app, it functions the same way.
Yeah.
And you don't have a login and password every time. You're secure as soon as you turn on HealtheMed. So the conversation is very easy. It's also life size. So you and I are talking right now on our computer, but when this comes on the television in the home, the doctor can see you and can see into a place where they haven't prescribed medicine or healthcare for the last 100 years, since house calls stopped being commonplace.
Mm-hmm.
So this is something that distinguishes us. And to this day, we don't have any competitors yet. And there are two reasons for that, and I can go into those briefly if you'd like.
Yeah, why don't you?
We don't have any competitors, first, because we selected a place where healthcare really hasn't done a very good job of serving the people. It's well known, it was certainly true when I managed medical practices, that we didn't want to expand our Medicaid business. It just didn't make us any money. Now, it wasn't because we didn't care about people that had asthma or allergies or problems with conception, for example. It isn't that we didn't care about them. It's that we couldn't make any money with them, right? So every time we took on a Medicaid patient, we would lose money to serve them. And you can do that for a certain percentage just because you want to maintain a a business, especially in family medicine. But you can't do that for the majority of your practice. And that's been true for the last 25 years. So people don't realize that. The second reason that we did this was that we knew that the operating system of televisions through the world's manufacturers, Panasonic and Samsung and the big ones, Sony, was not compatible with Android. And it was going to be quite a work project to work through getting enough of that compatibility through the television OS to actually have a reliable video and audio experience with the physician. And so that was the next reason that we decided that we really had to dig deep. And we found a partner in Sony Corporation. And Sony, we said to Sony, why us? We're a little startup. And their response was, well, we're not just in the technology business. We're in the customer satisfaction business through programming. We've got Sony movies, we've got games, we've got the experience of being more than a television manufacturer. And we see you, HealtheMed, as the tip of the spear or the vanguard, if you will, of a new model of service. And that model of service might be medicine. And certainly Sony was aware, like most international corporations, that the biggest industry yet to be disrupted by tech in the world is the US healthcare economy.
Mm-hmm.
So they wanted in, and the big ones all want in. Google, Amazon, they're all trying to get into the space, but none of them yet has determined that they want a channel on your television or an app on your television that's bidirectional. And we said, look, we think this is the way, especially with Medicaid recipients who spend a lot of their time in front of their television, right? This is their window to the world for many of them. So it's worked out well for us.
That's really great. And I appreciate you taking the time to share that with the audience. So knowing that this show, right, is targeted towards people who may be in their first few years of business, do you have any final thoughts or words of advice you'd like to share with our audience today?
Yes, I would say that the first, second, and third greatest priority for the young business entrepreneur is to surround yourself with people that share your values, people that you can trust, because life's too short. And at my stage, I was too old to go through another experience where I didn't have people around me that were my peers, certainly in terms of skill set, and oftentimes better, for sure. And people who shared my values and our vision for the future. And if you've got that, you've got some funding, which is really important, then you've got what it takes to succeed, right? To work through those troubles at the very beginning. But money alone won't do it. So we could go out and get someone like John Channon, for example, who's a name brand, and maybe cause investors to come into the fold. But it's going to take more than that. It's going to take great people. And I think by an order of magnitude of perhaps 5, that's the most important thing you can do, is to surround yourself with people who you can trust and who can get the job done.
Well, thank you so much for your time today, Tom.
Well, you're welcome, John.
Yeah, it was great meeting you and learning more about your refreshed entrepreneurial journey. And to everyone watching, I look forward to seeing you in our next episode.